Welcome back to the channel. Today, we're diving into one of the most important and often overlooked parts of the 2025 AHA CPR and ECC Guidelines, ethics. If you're a nurse, paramedic, physician, or healthcare student, this update reshapes how we think about resuscitation, decision-making, and patient dignity. Let's break it down. Why ethics matter. Every resuscitation attempt is more than a clinical event, it's a moral moment. The 2025 update expands and strengthens ethical guidance across resuscitation practice, with a strong emphasis on equity, decision-making, prognostic uncertainty, and support for families and providers. So, first let's see the updates in 2025 guidelines regarding ethics. Ethics is explained into 9 categories. 1. Expanded ethical frameworks. 2. Strong emphasis on equity and social determinants. 3. Clearer guidance on advanced directives and shared decision-making. 4. Updated guidance on initiating, withholding, and terminating resuscitation. 5. Ethical considerations for special populations. 6. Family presence during resuscitation. 7. Ethical use of advanced therapies. 8. Ethical responsibilities in research and knowledge generation. 9. Impact on providers, survivors, and lay responders. And 10. Updates on organ and tissue donation. Let's see about expanded ethical frameworks. The AHA now integrates multiple ethical models to guide complex CPR ECC decisions. Principalism, beneficence, non-beneficence, autonomy, justice. Dignity as an explicit ethical value. Narrative ethics, patient story or context. Utilitarianism, maximizing benefit. Virtue ethics. Deontology, crisis standards of care for resource-limited situations. This broader framework helps clinicians justify decisions in ethically ambiguous scenarios. Next, let's see about strong emphasis on equity and social determinants. The AHA highlights the ethical imperative to address structural inequities and disparities in emergency cardiovascular care. This includes recognizing how race, socioeconomic status, and access to care affect outcomes, ensuring equitable access to CPR training, AEDs, and advanced therapies, institutional responsibility to reduce disparities. Next, let's see about clearer guidance on advanced directives and shared decision-making. The 2025 update strengthens processes for patient-centered decision-making, respect for advanced directives, early, ongoing shared decision-making with patients or families, transparent communication about prognosis and treatment options, documentation of patient values and goals of care. Next, let's see about updated guidance on initiating, withholding, and terminating resuscitation. The guidelines provide detailed ethical considerations for decisions to start, withhold, continue, or stop CPR. It applies to adults, geriatrics, pediatrics, neonatals, and pregnant patients. Considers prognostic uncertainty and the risk of ineffective therapies. Encourages culturally and religiously sensitive communication, and supports clinicians in ethically justified termination of resuscitation, TOR. Next, let's see about ethical considerations for special populations. Specific guidance is expanded for children, newborns, pregnant patients, and geriatric patients. Each group has unique ethical and prognostic considerations. Next, let's see about family presence during resuscitation. The AHA continues to support family presence during resuscitation when feasible, emphasizing respect for family needs, structured support for families and staff, and minimizing interference with care. Next, let's see about ethical use of advanced therapies. The guidelines address ethical issues related to extracorporeal CPR, ECPR, mechanical circulatory support, and organ and tissue donation. Focus: balancing benefit, resource use, and patient values. Next, let's see about ethical responsibilities in research and knowledge generation. The AHA highlights ethical conduct of resuscitation research, protection of vulnerable populations, and transparency in data use and consent processes. Let's see about impact on providers, survivors, and lay rescuers. The guidelines acknowledge the emotional and psychological impact of resuscitation on healthcare professionals, survivors, families, and lay rescuers. Ethical duty: provide support, debriefing, and mental health resources. Organ donation. Now let's talk about one of the most sensitive and most meaningful ethical areas in the 2025 AHA Guidelines: organ and tissue donation. The updated guidance emphasizes a simple but crucial principle. The resuscitation team's only job during CPR is to save the patient's life. Discussions about organ donation must never influence the decision to start, continue, or stop CPR. 1. Clear separation of roles. The guidelines draw a firm ethical boundary. The team performing CPR must focus solely on resuscitation. Conversations about organ donation should only begin after death has been declared, and ideally by trained personnel, such as organ donation coordinators or specialized staff. This protects the integrity of care and prevents any perception of conflict of interest. 2. When donation discussions should occur. Donation discussions should happen after the clinical team has made an independent decision that further resuscitation is futile. Only then can the family be approached, gently, respectfully, and with full transparency. The 2025 update stresses that families must never feel pressured or rushed. This is a moment that requires compassion, clarity, and space. 3. Ethical principles behind donation. Organ donation is grounded in the same ethical principles that guide CPR: autonomy, honoring the patient's documented wishes or donor registration; dignity, treating the patient and family with respect throughout the process; justice, ensuring fair and equitable access to donated organs. The guidelines remind us that donation can be a powerful act of generosity, but only when it aligns with the patient's values. 4. Special considerations in donation after circulatory death, or DCD. For patients who do not meet brain death criteria, the guidelines acknowledge donation after circulatory death, or DCD. Here, the decision to withdraw life-sustaining treatment must be made before any discussion of donation. Again, this separation protects ethical integrity and ensures that end-of-life decisions remain patient-centered. 5. Supporting families through the process. The 2025 AHA Ethics Update highlights the emotional weight families carry during these moments. Healthcare teams are encouraged to provide clear, honest explanations, allow time for questions, offer spiritual or cultural support, coordinate with donation specialists to avoid overwhelming the family. Ethically, the goal is to support, not persuade. The 2025 AHA Ethics Update reinforces that donation is a gift, not an expectation, and that preserving trust between families and healthcare teams is essential. Supporting healthcare professionals. Resuscitation can be emotionally heavy. The 2025 AHA Ethics Update acknowledges moral distress among clinicians and encourages structured debriefing, psychological support, and ongoing ethics education. The 2025 AHA Ethics Update reminds us that CPR isn't just a technical skill, it's a human one. Now, we're exploring one of the most challenging ethical moments in emergency care, when a patient's wishes, family emotions, and clinical urgency collide. This case scenario brings the 2025 AHA CPR and ECC Ethics Guidelines to life. The patient's wishes. Mr. Mack is a 68-year-old man living with advanced heart failure and chronic kidney disease. He's tired, he's been hospitalized multiple times, and he knows his prognosis. During admission, the nurse asks about code status. Mr. Mack looks up and says quietly, "If my heart stops, I don't want CPR. I don't want machines. I've lived my life." He signs a DNAR, a Do Not Attempt Resuscitation Order. His daughter, Apple, is at his side. She understands. She supports him. The event. 2 days later, everything changes. Mr. Mack suddenly becomes unresponsive. No pulse. A rapid response is called. When the team arrives, they find his son, who just flew in from abroad, standing at the bedside, panicked and shouting, "Save him! Do everything! He never told me he didn't want CPR." The daughter is crying. The son is pleading. The DNAR is in the chart, and the clock is ticking. This moment captures the heart of ethical resuscitation. The patient's autonomy says, "Do not perform CPR." Beneficence and non-maleficence say, "CPR is unlikely to help and may cause harm." Justice says, "We must use resources appropriately." Cultural values say, "Family decisions matter, especially in collective cultures." And emotionally, everyone in the room is hurting. What the team should do. The 2025 AHA Ethics Guidelines give us clarity. Step 1, honor the patient's autonomy. The DNAR is valid. CPR should not be started. Step 2, communicate with compassion. A senior clinician steps forward and says, "I hear how much you love your father. He made a clear decision, and our duty is to honor his wishes." Step 3, support the family. A staff member stays with the son, acknowledging his shock, his grief, and his sense of being left out. Step 4, provide comfort-focused care. The team focuses on dignity, give oxygen, positioning, family presence, silence, respect. After death is declared. After death is confirmed, the guidelines draw a clear ethical boundary. Only after resuscitation decisions are complete, only after death is declared, only by trained personnel can the family be gently approached about organ and tissue donation. This separation protects trust. It ensures that CPR decisions are never influenced by donation considerations. Teaching points. This case teaches us the core of ethical CPR. Autonomy comes first, even when families disagree. CPR is not always the ethical choice. Cultural sensitivity matters but cannot override patient wishes. Communication is an ethical act. Organ donation discussions must never influence CPR decisions. Compassion is part of clinical excellence. Thanks for sticking with me through this breakdown of the 2025 AHA Ethical Guidelines. If this helped you think differently about CPR, decision-making, or patient dignity, go ahead and hit that like button. It really supports the channel. And if you want more clear, practical updates on CPR, ECC, and clinical ethics, make sure you subscribe so you don't miss what's coming next. Stay informed, stay compassionate, and I'll see you in the next video.